Well, if you're dealing with hand or wrist pain, you're not alone, and it might be more than just overuse.
In today's Focus on Your Health, Meg Judy sits down with an MU Healthcare orthopedic surgeon to talk about when to get that pain checked out, what could be causing it, and how it can often be treated without surgery.
Focus on Your Health is sponsored by MU Healthcare.
With me now is MU Healthcare's Dr. Julia Nuelle. She's an orthopedic hand and microvascular surgeon. She's here to talk about hand and wrist pain. Thanks for being with me, Dr. Nuelle.
Thank you, Meg. I'm glad to be here.
So you're an outstanding surgeon, we know that, but not all hand and wrist pain requires surgery, right?
That's right. Sometimes hand and wrist pain can be improved just with mild changes in your activities, maybe some occupational therapy, things like that.
So what are some of the signs if you've got that hand and wrist pain that it's time for medical attention?
Yeah, if it's lasting longer than 2 weeks, you're starting to have numbness and tingling in the fingers, things that just aren't resolving on their own, that's time to go get things looked at. And because sometimes if we intervene early, it can be something as simple as activity modification and nighttime bracing for an early carpal tunnel syndrome that can resolve the symptoms.
So carpal tunnel, that is a very common cause of this hand and wrist pain.
That's exactly right. Yeah, about 5% of the population actually has some form of carpal tunnel syndrome. Sometimes that manifests as pain, weakness, even numbness, tingling, and you're starting to have symptoms like that, particularly if they're interfering with your daily life. It's probably time to get it checked out. But almost 90% of people don't end up needing surgery, and so there's lots of things that we can do, and we'll work with you to figure out what is the underlying etiology and what do we need to do to treat it.
So what's the cause of carpal tunnel syndrome?
Yeah, so there's a nerve that runs basically from the armpit down to the hand, and there's a space in the level of the wrist that the floor and the sides of that are made of bone, and the top is this thick ligament. And if there's anything that creates increased pressure in that tunnel or increased volume, the nerve can get compressed and manifest as the symptoms of numbness and tingling, pain, weakness.
Probably keep you up at night.
Definitely, yes. And if it's starting to wake you at night, that's certainly a time to get checked out.
So surgery, if you've hit the point where you're like, it's time for surgery, what?
Right.
Is it an immediate relief? What does it look like?
Yeah, that's a great question. So oftentimes if pain is one of the major symptoms, people notice an improvement in that even within the first 24 to 48 hours. But the numbness, tingling, the weakness, that all kind of depends on how severe the compression was initially and how involved the nerve damage is.
So tell me about the procedure room. What could patients expect if they're going in?
Yeah, the procedure room is really a great option for folks because it doesn't require fasting. There's no general anesthesia, so folks that may be a little apprehensive about having surgery, this could be a great option for them to get the carpal tunnel released. We also do it in an operating room setting for those that are fearful of the idea of being awake during surgery. But for the procedure room, they come in, again, don't have to fast. It's about a 15-minute procedure, and once the small incision is closed, and they have their dressings on, they just walk right out. And because we use really small incisions and we have specialized training in this, we're able to do that for patients throughout our system.
It's a great option.
Yes, ma'am.
Thank you so much for being with us. To learn more about carpal tunnel syndrome diagnosis and treatment at MU Healthcare, you can visit muhealth.org/carpal tunnel care. For Focus on Your Health, I'm Meg Judy.
Focus on Your Health has been sponsored by MU Healthcare.